Hi, this is Wiley Long with HSA for America. The Senate is holding hearings on higher health insurance costs for women, and some activists are outraged that women are sometimes charged more for their health insurance than men. So I want to talk about that issue. First of all, is that really true? Are women charged more? Well, yes, they are until about age 50 or so. At that point, men's rates get higher than women's rates. So what is going on here? Do evil insurance companies not like women, or perhaps just not like younger women, and therefore are discriminating against them, or is there something else? Well, of course there is something else. The reason young women's rates are higher than young men's rates is because they have higher medical costs, and they file more claims. So in its wisdom, Congress has decided that this is not right, and they are going to outlaw differential pricing for men and women. So let's talk about what the results of that will be. If they put this into law, then to cover medical costs for these women who are filing more claims than the men, the only way to do that is to charge the men higher rates. So that's what will happen. The higher rates that the men pay will go to subsidize the real cost of health insurance for the women. So anytime the government gets involved with pricing like this, we have some unintended consequences. So let's talk about what those are. First of all, the men will now be paying more for the same health insurance they would otherwise be paying less for. So many of the men may decide that it's not as good a value, which they're correct, and thus they may decide not to get coverage. The women, on the other hand, will be paying less than they would have because their premiums are now being subsidized. So they may see this as a better value, which it is, and more women may decide to get health insurance than otherwise would have. So what happens here? More women get health insurance. The women are filing more claims. Fewer men who file less claims are getting health insurance, so costs go up and revenue goes down. So what is the response to that? Well, it's to raise premiums on everybody, but particularly to raise premiums on the fewer men that are now getting coverage to pay for the subsidized premiums for the larger amount of women that need coverage. So these are the unintended consequences of government interference in what should be a private market system, and is one more example of what's going wrong in the whole healthcare debate.